Hi everyone. Today we are going to do clinical pharmacy quiz. So let's start. Cognitive development. Which of the following medications is most likely to cause hyperkalemia? A. Furosemide. B. Spironolactone. C. Hydrochlorothiazide. D. Atenolol. The correct answer is B. Spironolactone. Spironolactone is a potassium-sharing diuretic that can cause hyperkalemia by inhibiting aldosterone receptors in the distal nephron, leading to decreased potassium excretion. Next, a patient with a history of chronic heart failure presents with worsening symptoms. Which of the following medications should be initiated to reduce mortality? A. Amlodipine. B. Digoxin. C. Metoprolol succinate. D. Furosemide. The right answer is C. Metoprolol succinate. Beta blockers such as metoprolol succinate have been shown to reduce mortality in patients with chronic heart failure by blocking the harmful effects of chronic sympathetic nervous system activation. Next, which of the following is a common adverse effect of angiotensin converting enzymes inhibitors? A. Hypokalemia. B. Cough. C. Hyperglycemia. D. Tachycardia. The right answer is B. Cough. AC inhibitors commonly cause a dry, persistent cough due to the accumulation of bradykinin and other substances that stimulate the cough reflex. Next, a 65-year-old male with type 2 diabetes and hypertension is prescribed lisinopril. What is the primary reason for using this medication in the patient? To reduce blood glucose levels, to protect kidney function, to increase insulin sensitivity, and finally, to reduce heart rate. The right answer is B. To protect kidney function. AC inhibitors like lisinopril are beneficial in patients with diabetes and hypertension because they can reduce the risk of diabetic nephropathy, kidney disease, by lowering intraglomerular pressure and decreasing proteinuria. Next, warfarin therapy requires monitoring of which of the following laboratory tests? A. Complete blood count (CBC). B. Serum creatinine. C. International Normalized Ratio (INR). D. Partial thromboplastin time (PTT). The right answer is C. International Normalized Ratio. Warfarin's anticoagulant effect is monitored using the INR, which standardizes thrombin time measurement across different laboratories and help assess the risk of bleeding or clotting. Thank you so much for watching. I hope that you like the video. Please don't forget to subscribe, like, and share the video. See you soon. Bye.